Let's talk about the side effects of regularly using something called Ozempic. And right now, millions and millions of women all around the world inject yourself with Ozempic, and you don't realize how much harm do you do to your body. And in today's video, I will explain everything, especially for you women after 50 years and older. What is Ozempic really? Ozempic is a brand name for the semaglutide, a synthetic version of hormone your body already makes called GLP-1. And GLP-1 stands for glucagon-like peptide 1. Your gut produces it naturally every time you eat, and it tells your brain you are full, stop eating. It tells your pancreas release insulin, control blood sugar. It slows digestion so food stays in the stomach longer. This is beautiful natural system, but Ozempic does not gently support this system, it overrides it. It floods the body with synthetic GLP-1 signals that is far stronger and lasts far longer than anything your body are designed to handle. And that's where the problem begins, especially in women over 50. And I see regularly in my patients for the last 26 years, you always take shortcuts. You really don't want to eat healthy, live healthy. You just want to one single pill, one single injection, and that you really don't need to take any kind of effort for your health. You are so wrong, my dear viewers. The first problem with Ozempic is muscle loss problem. This is one that almost nobody talks about. When you lose weight on Ozempic, you don't just lose fat, you lose muscle. And studies published in New England Journal of Medicine showed that up to 40% of the weight lost in semaglutide was the lean body mass, not fat. And for a woman over 50, this is devastating. After menopause, women already lose muscle at accelerate rate roughly 1 to 2% per year. And the muscle is what protects your joint. Muscles is what keep your bones strong, and muscles is what keep your metabolism alive. When you strip muscle away with a drug like Ozempic, you may see a lower number on your scale, but what actually happening inside? Your metabolism is slowing down, your bones are becoming more fragile, and your risk of falls, fractures, and going up. This is why researchers have given the name Ozempic face or Ozempic body. The gaunt age appearances that comes with rapid muscle and the facial fat loss. And we are living proof what's happening right now all around the world. You can see all those people really on everyday news. They have a so much worse facial expression. They lose a lot of muscle mass, and you don't realize it. The scales goes down. You think this is so perfect. Really, I don't need to do anything. I just inject myself, and you lost not just fat. Of course, you lose body mass and body muscle mass. This is so important. The second important information is going to be loss of bone density. After menopause, estrogen levels drop dramatically, and estrogen is one of the main hormones that protects bone density. When you combine low estrogen with rapid weight loss and the muscle wasting, you're creating the perfect condition for osteoporosis. A 2023 study published in Lancet found the patients on GLP-1 receptors agonist showed measurable bone mineral density changes, particularly in the hip and the spine. And for a woman over 50, a hip fracture is not just an injury, it can be life-changing. And up to 30% of elderly patients who suffer with hip fracture die with 1 year. Did you heard me, my dear viewers? Osteoporosis is one of the main reasons why you lost your job, you don't work at all, especially a woman after 50. It is number one disability reason for women over 50. Osteoporosis, and of course problems with your knees, especially with your knee joints. Everything that is connected with the bone loss, bone health is going to get a lot worse with Ozempic, my dear viewers. That means osteoporosis, that means also arthritis is going to get a lot worse. But we don't think about it. Third unbelievable information is going to be the stomach that stops working. This is called gastroparesis. Ozempic works partially by slowing stomach emptying, but in some patients it slows too much, and this condition is called gastroparesis, and reports have increased dramatically since Ozempic became popular. And symptoms include severe nausea, vomiting, stomach pain, bloating that does not go away. And the American Society of Anesthesiologists issues a warning in 2023 that patients on semaglutide face aspiration risk during surgery because food remains in the stomach far longer than normal. And for women over 50 who may need surgery for joints, backs problems, and other related age conditions, this is a real and under-discussed risks. Of course, let's go further, my dear viewers. This is all scientifically proven and researched, and you just take Ozempic each day like there's nothing. Of course, when you take Ozempic, with all those side effects, you will get a lot of problems with gallbladder, especially with pancreas. Rapid weight loss has always been connected to gallstone formation, and Ozempic accelerates this. The prescribing information for semaglutide itself lists acute gallbladder disease, cholestasis, gallstone pancreatitis, and inflammation of the pancreas. And studies have shown 50% higher incidence of gallbladder-related events in patients using GLP-1 drugs compared to the placebo. Of course, my dear viewers, gallbladder will gonna suffer, your bones gonna suffer, you will have osteoporosis, you will have muscle loss. Of course, you can see people all around you who use Ozempic. They look just like this. But that's not all, my dear viewers. This is especially important for you people after 50 years and older. It's gonna be a problem with your thyroid, my dear viewers. The thyroid warning, this one is right on the label. Yet most people don't know it. The FDA requires the black box warning on Ozempic. In animal studies, semaglutide caused thyroid C-cell tumors, including medullary thyroid carcinoma. And women over 50 already face elevated thyroid disease risk. And the official label states it is not known whether Ozempic causes thyroid C-cell tumors, including medullary carcinoma in humans. Not known, that means the long-term data does not exist yet, and millions of women are taking it right now. Yes, my dear viewers, it's going to be thyroid problems, even the risk of carcinoma. Let's go talk about something that is called rebound effect. What is really is going to happen when you stop using Ozempic, my dear viewers? Here is what most people frustrating is. When you stop Ozempic, and most people eventually do because of the cost, side effects, or choice, the weight comes back. A study in the journal Diabetes, Obesity, and Metabolism showed that patients regained 2/3 of the weight they lost within 1 year of stopping semaglutide. But here is the critical detail. The weight that comes back is mostly fat. The weight that was lost include muscle. You end up in worse metabolic position before you started. Less muscle, more fat, slower metabolism, my dear viewers, and this is everything that is going to happen to you. There's a lot more side effects that we don't know already. This is just a couple of very important ones. So if you use Ozempic, please be aware what you're using. In my opinion, there is no better way to have normal weight. It's going to be eat healthy, practicing something called intermittent fasting or similar kind of diet, exercise regularly, and use only natural medicine that had no side effects. And we really can do this. Of course, after 50 years and older, it's a lot harder, but it doesn't matter, my dear viewers. We all do this, but because this Ozempic is just like a quick fix, no effort, weight loss, but what cost, my dear viewers? This is very important, my dear viewers. If you want to find out a lot more about weight loss in the perfectly safe and natural way, watch my video right here on this little square, my dear viewers. Thank you for following me. See you the next time. Bye bye.